regenerate, right? We are a system of systems. So as we start to repair these things, the systems in our body start to do the things that they're supposed to do at a higher level, at an optimal level, right? Not struggling, as many of us feel symptoms as we're in pain. There can be fatigue, there can be other things. We're just not feeling our best self. We don't have that vitality we used to have. So tuning up these systems allows us to lay the foundation for this entire framework of how we treat people in the next phase of my practice, which is really regenerative medicine. So how is regenerative medicine different than standard, say, pain medicine, orthopedic medicine? Well, a lot of those treatments oftentimes entail some symptom-based treatment. So we're trying to suppress inflammation with anti-inflammatory medications. We're trying to help joint pain by putting a little cortisone in that joint to settle the inflammation down. And there's nothing on the surface wrong with that, but it really is a short-term strategy. And what I'm trying to look at is building long-term strategies with people to get the problem to go away, to not impair their life, allow them to get back to the things that they want to be doing. So as we move over into here, we're going to think about what are treatments that can actually help the body or enhance those innate or natural repair mechanisms that our body has. The three main categories we use in our practice: stem cell therapy, platelet therapy, or what's referred to as PRP, and prolotherapy. So multiple different types of this treatment out there. We won't get in that today's video. I'll do that in a future video. We'll really break out these individual therapies. But the root of this, or what we're trying to accomplish with these treatments, are again, stimulate the body's natural healing mechanisms, right? So we have this turnover process. And if we can accelerate that turnover process, right, we can build new cells or halt the progression of that degeneration. Because ultimately what it is a balancing act. You know, patients come in to see me, they have been told they have a degenerative knee, right? So some of that cartilage has worn away. It might be mild, moderate, some people even bone on bone. There are some residual cells in there, so they're not completely obliterated. And the concept with stem cell therapy is that we can potentially repopulate some of those cells in there and make that joint more resilient to the demand we want to put on it. So very simply stated, these cells, stem cells, platelets, they are natural healing cells in the body, right? They can seek out areas of damage or orchestrate the influx of cells to actually repair tissue. So that's the incredible thing about it. What I find just most amazing about this when we work with patients is that we're using your body to heal your body. So we may apply one of these therapies. We may stop here if that's all it takes to get people where they want to be. But oftentimes when people are coming in with a state of osteoarthritis that may be moderate, really compromising their ability to do things, we influence that situation by using these type of treatments here. In the last phase,